The treatment of pancreatic cancer depends on the stage the cancer is at the time of diagnosis. Cancer in the early stage means it's not spread outside of the pancreas. If the cancer has spread outside of the pancreas, surgery is not possible. Surgery to remove the tumor as part of the treatment is the only way to cure pancreatic cancer. Surgery is performed when the surgeon believes all of the cancer can be removed. Patients need to discuss the risks and benefits of this type of surgery with their doctors before making a decision. The two main procedures used to remove pancreatic tumors are the WHIPPLE procedure and pancreatectomy. The WHIPPLE procedure is the most common surgery performed to treat pancreatic cancer, as the majority of cancers originate in the head of the pancreas. On average, the WHIPPLE procedure is performed in 6 to 8 hours. The WHIPPLE procedure is a major surgical procedure with risks. Most recent data shows that the risk of death is currently in the range of 1.6 to 5%, with an average hospital stay between 8 to 14 days and need for intensive care unit admission in 12 to 15% of cases. Blood transfusions are needed in 10% of cases, and reoperations are necessary 5 to 6% of patients. Pancreatectomy is the removal of the entire pancreas. Possible complications after these procedures are performed may include infections, blood loss during the surgery requiring transfusions, leaking of the bile or pancreatic juices, difficulty emptying the stomach after eating, inflammation of the pancreas, failure of other organs such as the heart, kidney, and liver. After surgery, patients are on intravenous drips and usually not allowed to eat for the first 5 to 6 days. Pancreatic surgery has improved significantly over the last 20 years. Even so, surgery to remove a pancreatic tumor is complex. When patients return back to their homes, they usually find movements and activity difficult for the first few weeks, and they likely require some help from family or friends. Their ability to eat takes several months to improve. Patients often return to their normal activities after 2 to 3 months. There are usually no restrictions on activities after that time. As the pancreas produces insulin that's required for control of blood sugar, there's the risk of developing diabetes after this operation. Patients who are not diabetic before surgery are 10% more likely to develop diabetes afterwards. Patients who are diabetic before surgery are likely to need additional diabetic medications or insulin after the operation. Malabsorption is another possible long-term complication. Malabsorption is the poor digestion and absorption of food, resulting in loose stools that are greasy and pale. The pancreas produces enzymes required for digestion of food. Removal of part of the pancreas decreases the production of these enzymes. Therefore, in some patients, there is a need for long-term treatment with pancreatic enzyme capsules to be taken by mouth with each meal. It is common for patients to lose weight compared to their weight before their illness. After the operation, patients usually start regaining some of the weight lost by 3 months after surgery. After the operation, there is no restriction to patients' diet, though most of the individuals after the WHIPPLE procedure will be able to eat only small amounts of food at one time as part of the stomach is usually removed. Patients may need to have small meals and snack between meals to minimize symptoms of bloating or discomfort. Dietitians can give advice about diet and supplements that can improve patients' nutrition. In general, it takes several months for patients' digestion and ability to eat to return to normal levels.